But thank goodness we've got our next guest. It's our good friend Nick Tate, the Newsmax deputy health editor, who is the author of the Obamacare Survival Guide. Nick, it's great to have you back here on the anchor desk at America's Forum. Obamacare survival notwithstanding, what is the deal with the flu?
Well, this is going to be the year that flu survival is going to be really important. What's happening is that the CDC is saying that the number of flu cases, deaths, and hospitalizations as a result of influenza is much higher than it typically is at this time of year. One big reason, as Francesca mentioned, is that the particular flu strain that is causing most of the cases, the flu shot does not offer protection against. What happens is every year the flu virus mutates, the genetic makeup changes, and that's why you need a new flu vaccine every year to stay protected. Last year's flu vaccine won't work against this year's flu, but what's happened in this year is that one of the strains of flu that they're seeing out there, the most common form, has mutated since the vaccine came out. So if you get the shot, you're not going to be fully protected against it. That's why they're seeing all these cases.
So now, what causes the flu virus to mutate like this?
It's just a part of its ability to survive. That's how they live. That's one of the things that makes viruses what viruses are. A comparison would be bacteria that develop resistance to drugs over time. They're different microbes, but they work by the same principle. So the genetic makeup changes year to year.
Well, we hear about this, and there's always the concern of the advent of a super flu, for lack of. Is that what we're seeing in essence this year?
We're not seeing that yet. The concern with the super flu, those major flu outbreaks like the 1918 Spanish flu, which killed tens of millions of people worldwide, those typically happen when they see a flu cycle between, say, birds or animals, bird flu, swine flu, and particularly virulent strains that you can do nothing about. That's not quite the case here, but they are seeing a larger number of deaths than they typically see. About 7% of people who've been affected are actually dying. That's the death rate based on the sentinel searches they're doing. And so far, unfortunately, we've seen 15 children in that category. So what CDC is recommending is that it's still not too late to get a flu shot. The flu shot can offer some protection against the other strains of flu that are circulating and limited protection against this particular strain, but it's going to be have a limited effect. They are also recommending antivirals like Tamiflu and Relenza, but unfortunately those antivirals are not very effective. They only shorten the duration of flu by less than a day, 21 hours, and they carry some nasty side effects: gastrointestinal distress, nausea, vomiting, and in some rare cases, hallucinations, confusion, and even suicidal thoughts. So the best thing you can really do is try to prevent flu. Do everything you can to boost your immunity and stay healthy.
And then what are the areas in the U.S. you think that have been hit the hardest by
Pretty
flu?
much everywhere in the U.S. Every region, they track 10 regions in the country. Widespread flu is happening in virtually every region of the country. It's hitting 22 states particularly hard, and in 36 states there are much higher than normal levels of flu. But virtually every region of the country is affected. And of course, this is the time when people are traveling for winter break and for the holidays, and that is going to increase the likelihood that it's going to get worse before it gets better. They usually see a big bump in flu cases after the holidays in January. That's when flu season peaks. Sometimes February, but because of the strains that are out there and the vaccine's limited effectiveness, we're seeing that start to happen early.
And so it's, we talk about the post-holiday blahs. Tomorrow morning, some people will wake up and have hangover-like symptoms, but it sadly may not be the hangover. It could be the flu.
Absolutely true. In fact, it's already happening in a lot of cases. Those family get-togethers, those holiday get-togethers bring a lot of people together, the hugging, kissing, the shaking of hands, and that's the best way to spread flu. So it's really important, if you don't have it yet, do what you can to keep your resistance up. You want to eat healthy, you want to get enough sleep, you want to make sure you're exercising, and for goodness sake, if you're not feeling well, stay home. Don't go to work and infect your coworkers.
Fair enough. Got to survive the flu, and of course the book that Nick wrote is the Obamacare Survival Guide. Nick, as always, we thank you. Be sure to take the National Medicare Survey. Tell Congress what you think of the recent changes to Medicare. And America's Forum will continue right after this.